Hello, my name is Curtis Dickey, Fire Captain, Paramedic. This training video will cover the proper setup and operations of IndeeLift's patent human floor lift for emergency medical services, or the HFL. They are rugged and reliable industrial-grade tools designed specifically for emergency responders. Lift-related injuries are common among emergency service personnel. IndeeLift's HFL for EMS eliminates the manual lifting of patients from the floor on emergency medical calls or lift assist. They lift a patient from the floor, whether seated on the ground or on a backboard, without causing injury to the patient or the care provider. The HFL has a small footprint and is very maneuverable. This allows for recovery of a patient in small areas which other mechanical lifting devices are not able to get to. Also, designed to transport the patient from the incident site to the location of the gurney when required. The HFL is designed to be 100% maintenance-free. No lubrication or user servicing required. You can decontaminate the unit using bleach or any standard solution, or you can wipe it down with mild soap and water.
This training video was designed to supplement the IndeeLift HFL-500-E User's Manual. Any personnel using this equipment should read the User's Manual, view this training video, and practice the procedures with fellow EMS personnel before using the equipment in the field. IndeeLift human floor lifts for EMS are state-of-the-art tools designed and built in the USA using high-quality stainless steel and aluminum. Let's take a look at the major components of the HFL-500-E. Transport handles, left and right. Sealed up-down rocker switch. Upper belt anchor points, left and right. Belt assembly, 1 and 2. Belt stowage compartments, left and right. Rechargeable lithium-ion battery pack. Lower belt anchor points, left and right. Outrigger retention knobs, left and right. Mounting ramp seat. Seat retention knob. And outriggers left and right.
Each HFL for EMS comes with 2 rechargeable lithium-ion batteries and a charging station. These batteries should be swapped out weekly or per your department's protocols. Each charge should give you approximately 30 lifts. When charging the batteries, you'll take your charging station and your power cord, take the round end of the power cord, place it into the back of the charging station, then take your plug and plug it into a standard 110/120 outlet. The charging station is keyed for the battery, so there's only one direction that the battery can go into the charger. Place the battery into the charger for 8 hours till it's fully charged. After 8 hours, we will remove the battery from the charging station and place it in the HFL. Again, the battery is keyed, so it only goes in one direction. Once the battery is in place in the HFL, you want to confirm that the latch has snapped back and is holding the battery in place.
Note, the charging system is automatic. The green LED on the charging brick illuminates when input power is present from either a 110 or 220 AC power source. Once the inserted battery is fully charged, the system suspends charging until a battery with less than a full charge is placed in the charging station. The charging system is designed to keep the primary battery on the machine with the backup battery stored in the charging base. Remove the HFL from its stowed position on the apparatus. Each outrigger is stowed in a vertical position and is held in place by a spring-loaded locking pin. Remove one of the outriggers by pulling outward on the locking pin and lifting the outrigger upward. Install the outrigger into its mounting point on the bottom front of the HFL, making sure that the black foot at the end of the outrigger is facing downward. On the other side of the HFL, remove the second outrigger from its stowed position and install it in the second outrigger mounting point. As before, ensure the black foot on the outrigger is facing downward. The spring-loaded retention knob will snap into place when installed correctly. Next, locate the spring-loaded retention knob on the lower column of the HFL and pull it outward with one hand while lowering the seat with your other hand.
We will now demonstrate the standard mount procedure. This procedure is used for a standard lift assist where the patient is conscious and simply needs assistance being lifted from the floor. We're going to position the HFL directly behind the patient's butt and encourage the patient to scoot directly back onto the seat. Can you scoot back? I want the patient to go all the way back until they are rested against the column. Good. This procedure is for patients that do not have the strength to scoot themselves onto the seat, so we'll need to assist them. We'll move the HFL directly behind the patient and scoot it into their bottom as close as possible. We will try to have the patient scoot themselves back. Sir, can you scoot yourself back? And if they're unable to, because they're just too weak, we're going to assist. We want to stay in a squatted position with straight backs. We want to get a hold of their clothing. It could be nightgown or pants, whatever you can get a hold of, and we're going to assist them onto the seat. All right, I'm going to pull you back, sir. 1, 2, 3. There we go. And we're going to pull them right onto the seat. A lot of times you do have 2 firefighters, one on each side, that helps pull the patient back onto the seat against the post. When the patient's laying on the ground or unable to scoot themselves on the seat, an easy way to place them on the seat is to bend their legs into an L position, place the seat directly under their bottom, and then assist the patient into a sitting position. Ready? We're going to sit up. 1, 2, 3, sit up. They will sit directly onto the seat and be in position to lift. Each HFL comes standard with 2 safety belt assemblies which are used to secure the patient to the lift and are stowed on the lift when not in use. Each belt includes 2 straps. The longer strap has a buckle with a snap hook at the end. The shorter strap has a clasp with a snap hook at the other end. Each of the 2 straps form a single belt assembly. In use, they're secured to the HFL's belt anchor points using the snap hooks at the end of each belt assembly. There's 3 sets of anchor points on the HFL, 6 in total. 2 sets, upper and lower, are located on either side of the HFL's main column and are the most commonly used. There's 2 additional anchor points on the forward frame underneath the seat, which provides additional strapping options for personal choice and unique situations, such as patient positioning. In many cases, only one belt assembly is needed. This belt is attached to the lower anchor points as a waist belt. This is the normal configuration for a standard patient lift, where the patient is able to sit upright by their own control, and the belt is used as a safety precaution while the patient is being lifted. Only one belt assembly is needed when lifting a patient secured to a backboard. The upper anchor points are used with the additional belt assembly when needed as a chest belt. The optional chest belt is used along with the waist belt as necessary when a patient is to be transported on the lift. The standard use of the belt assemblies as waist belts, chest belts, and for a backboard lift are covered in more detail in the operations section of the user manual.
While the standard belt configurations demonstrated in this video will work well for most situations, the HFL-500E has 6 anchor points, which provide responders with many different belt options, depending on the circumstances. These options include, but are not limited to, the configurations shown here.
Once the patient has been placed on the seat, we want to prepare them to lift. When we do this, we want to apply the waist belt to secure them into position. We'll remove the waist belt from the already attached cradle. We'll ask the patient to lift their arms. Will you lift your arms for me? Go around the patient's waist and attach it to the bottom anchor position. Once the belt has been secured, we want to take out all slack and make sure the patient is against the back post. Now when we're ready to lift, we'll let the patient know, I'm going to pick you up now. Just bring your legs in as we move. As when the patient confirms they're ready to go up, we'll press the up button on the rocker and begin lifting. This lifting process takes approximately 60 seconds. As the patient is moving up, we'll continue to encourage them to bring their feet in underneath them and confirm that they're staying squarely on the lift and not moving around. Now we want to begin on how the patient's going to be removed from the seat. Can they stand on their own? Do they need a walker, a cane, or maybe the patient's going to be moved to the gurney? For this patient, once he's up off the ground, he'll be able to stand under his own power, and we'll give him a little assistance. There we go. We are at the maximum height. We want to check with our patients, see if they're doing okay. Sometimes we need to finish our assessment prior to moving the patient. How do you feel, sir?
Doing well, thank you.
Excellent. So he's doing good. We will remove the belt and ask him if he'd like to stand and give him some assistance. Come on up. Bingo. Doing good?
Thank you.
Excellent. Once the patient is safely lifted off the floor and is on their feet, we need to return the HFL back to its stowed position. To do this, we'll remove one side of the belt, pick it up out of the way, and confirm there's nothing underneath the HFL as we lower the seat. From here, we will simply press the rocker switch to the down position and return it all the way down to the floor. Again, this takes approximately 60 seconds. When stowing the waist belt, we recommend leaving one side of the clasp attached to an anchor point, roll the belt, and place it into the belt holder. And then place the clasp inside that holder. Therefore, all of the webbing has been tucked and placed away. From here, we want to raise the seat into the up and lock position. We want to pull the spring-loaded pin until it locks into position. Now we'll remove both outriggers by, again, pulling up on the knob and sliding the outrigger out. From here, we'll place the outrigger into its stowed position and confirming the feet are pointed backwards and locked in position. Then we do the same thing on the opposite side. Pull up on the knob, remove the outrigger, and slide it into its holder. Again, confirming it's locked in position. This procedure is used to secure and transport a patient using the HFL. Once they're secured, a single operator can transport the patient safely down hallways, around corners, and through doorways. Once the patient has been secured with the waist belt, we now will apply the chest belt. We remove the upper belt from the holder, unravel the belt, and now this will go around the patient and under their arms. Sir, will you lift your arms for me? Go around. Now we'll take the clasp and attach it to the upper anchor. Then we will remove any slack that's left in the belt. From here, we are ready to raise the patient up to the height of 12 to 14 inches. Sir, I'm going to raise to the seat and raise you up off the ground. We'll press the up side of the rocker switch and begin raising the patient. Here we can tell them to scoot their feet back and continue to keep their feet underneath them the best that they can. I will watch the seat and again raise it 12 to 14 inches for a good balance point. There we go. When you've reached the 12 to 14 inch range, we need to let the patient know I'm going to tilt you backwards, sir. Just relax, cross your arms, and hold on to yourself. Excellent. Now when I pull the patient backwards, their feet can dangle down, or you can have the patient place their feet on the outriggers. For me, I will place my foot on the rear skid pad, and I'm going to pull the HFL back towards me and balance on the rear wheels. Sir, we're going backwards. Once we've reached the balance point and the patient continues to keep their arms crossed, we can now maneuver them anywhere we need to go. We can push the patient forward and go around turns or doors. We can also pull the patient backwards. It's preferred, if you can, to move forward with an additional firefighter in front, assisting with going around the corners and confirming that their feet or legs are not bumping into anything. This procedure requires at least 2 responders and is used to lift a patient that has been properly secured to a backboard for transfer to a gurney without manual lifting. With this demonstration, we'll take the IndeeLift and we want to place it at the abdominal area of the patient so they are balanced. We have one person on each end of the backboard and we will log roll them away from the IndeeLift. 1, 2, 3. So the patient is rolled away. We'll slide the IndeeLift into place. Roll him back. And he's on. Now once he's secured on the seat of the IndeeLift, we'll go ahead and use the chest strap. And the chest strap is going to go across the patient through a handhold on the backboard and then connect back to the other side of the strap. Once he is secure, we can just make it snug. It does not need to be tight. It's just for safety precautions. Now the patient is securely on the IndeeLift. Now we can go up, press the up button on the rocker, and the patient easily moves up. And the patient is balanced. No one's using their backs. We'll bring them to a height above the gurney, and the gurney will move in right next to the backboard, and then the patient will be slid off onto the gurney. Feeling good?
Doing fine.
Feeling secure?
Yes.
Okay. And we are at full height. Now we bring the gurney in, unconnect the seat belt, and slide the backboard straight onto the gurney.
While the HFL-500-E was designed to lift and transport patients, it's also the ideal tool for transferring a patient from an area that is inaccessible to a gurney, such as a bedridden patient in a back room, through hallways and around corners to the location of the gurney. Note: depending on the circumstances, the responders have the option of transporting the patient forwards or backwards, allowing them to choose the best method for optimal patient management through the pathway. The HFL was also designed to be used as a dolly to carry EMS equipment, tanks, hoses, or other cargo as necessary. Load the equipment or cargo on the HFL seat, then use the up-down rocker switch to raise the seat between 12 and 14 inches to provide optimum positioning for center of gravity and ease of transfer.
IndeeLift HFLs for EMS were designed to allow emergency responders to easily transport patients secured to the HFL on level ground. The optional stair handle set quickly assembles and deploys when needed. allowing emergency responders the additional flexibility of maneuvering patients already secured to the HFL, up and down stairs or through uneven terrain or obstructions. Note, at least 2 personnel are needed when using the stair handle set.
Each IndeeLift stair handle set comes complete with 2 upper handles, which are left-right specific, 2 lower handles, which are not left-right specific, and a storage bag, which can be mounted to the column of the HFL if desired. To install the upper handles, one responder positions themselves behind the HFL and locates the 2 upper mounting points on the top of the lift. Next, they position the upper handles to ensure the rubber grips face towards them and away from the lift. Reminder, the upper handles are left-right specific. Then, one at a time, the responder behind the lift pulls outward on the spring-loaded locking pin with one hand while inserting the handle into the mounting point with the other hand, then releases the locking pin and pulls upward on the handle to ensure it's secured in position. Once both upper handles are installed and locked into position and the patient is properly secured to the lift, as shown earlier in the patient lift and transport procedure, the responder asks the patient to cross their arms over their chest and put their feet together to make it easier for the second responder to install the lower handles. The responder behind the lift informs the patient that he is going to tilt the lift rearward. The responder puts one foot on the kick plate and uses the HFL's handles to tilt the lift for a good balance. Then moves the lift to the top of the stairwell, where the responder in front of the lift will install the lower handles. Install one of the lower handles into the mounting point on the front of the outrigger, positioning the rubber grip on the handle so it faces outward, away from the lift. While pushing against the spring tension, rotate the handle 90 degrees downward until it locks in place, and give it a slight tug outward to ensure it is properly secured. Repeat these steps for the second lower handle. Note, once you're familiar with these procedures, you can install or remove both lower handles at the same time. Reminder, unlike the upper handles, the lower handles are not left-right specific. Both responders coordinate their actions as they position the HFL's wheels to be evenly aligned with the first step at the top of the stairwell. Working together, saying 1, 2, 3, down, the emergency responder at the bottom of the HFL uses the lower handles to guide the wheels over the edge of the first step, allowing the wheels to bear the majority of the weight as they roll off the edge of the first step and on to the next step. Keeping their backs straight, the responders repeat the procedures for each stair step. Note, depending on the size and weight of the patient, up to 4 emergency responders can be used when transporting a patient using the stair handle set. Once the final step has been traversed, the responder using the upper handles keeps the HFL tilted slightly rearward while the responder in front of the lift removes the lower handles. The patient can now be wheeled to the awaiting gurney. With the patient properly secured and balanced for transport, position the back of the HFL's wheels to be evenly aligned with the first step. Note, the responder using the upper handles will be on the stairs behind the patient, approximately 3 to 4 steps up, as shown. Ensure the patient's arms are crossed and their feet are positioned inward, as the responder behind the lift uses the upper handles to tilt the lift slightly rearward, while the responder in front of the lift installs the lower handles and ensures they are secured in place. The responder at the bottom of the lift properly positions themselves to utilize standard safe lifting techniques, such as bending at the knees and lifting with the legs. The responders coordinate their actions, saying 1, 2, 3, up, as they use the stair handles to apply upward lift while guiding the wheels up the rise and onto the step, allowing the wheels to bear the majority of the weight as they roll up the edge of the first step and onto the next step. They repeat these procedures for the remaining stair steps. Once the final stair step has been traversed, the responder using the upper handles keeps the HFL tilted slightly rearward, while the responder using the lower handles removes them from the HFL. Note: when traversing stairs with the stair handle set attached, the responders should determine the best way to face based on the circumstances. Responders typically face each other when transporting a patient via stairs. However, when going upstairs, the responder using the upper handles has the option of facing away from the lift if they determine that's more appropriate to the situation. As previously mentioned, in an emergency situation, such as transporting a patient through rough terrain or obstacles during an evacuation, the stair handle set can be used to lift and carry the HFL off the ground. However, we do not recommend lifting the HFL off the ground with more than 200 pounds secured to the lift.
This procedure utilizes the optional INDEECHUCK patient maneuvering tool to retrieve a patient from an inaccessible area and move them to an accessible area. There, they can easily be lifted using the HFL. Typically, only 2 responders are needed when using this procedure.
Position the HFL in an easily accessible location. Remove the INDEECHUCK from its stored location on the HFL and proceed to the location of the incident. Unfold and position the INDEECHUCK to one side of the patient, then deploy the maneuvering straps. One responder assists the patient as they lean away from the INDEECHUCK, while the other responder positions it underneath the patient. Then have the patient lean to the other side, fully deploy the INDEECHUCK, then assist the patient to a seated position directly in the center. With one responder behind the patient and the other in front, pick up the maneuvering straps and slide the patient to the location of the HFL. While remaining upright, one responder stands behind the lift with one foot on the back of the HFL as both responders lift slightly and slide the patient to the center of the seat. Note: remain in a fully standing position while sliding the patient to avoid bending or back strain. At this point, the patient can now be lifted and transported if necessary, as previously demonstrated.
The IndeeLift HFL-500-E was designed to allow our emergency responders to safely lift and transport patients weighing up to 500 pounds on level ground. The optional stair transport system, STS, quickly attaches to the HFL-500-E when needed, allowing responders the additional flexibility of maneuvering patients weighing up to 380 pounds down flights of stairs. Note: at least 2 responders are needed when using the STS.
Each HFL-500-E stair transport system comes complete with 2 upper handles, 2 lower handles, and the stair tread adapter. As with the stair handle set accessory, the 2 upper handles are left-right specific and the 2 lower handles are not. The stair tread adapter also includes a storage plate with clips that secure all the stair transport system components when not in use. The storage plate also has an opening at one end that serves as a convenient carrying handle for the stair transport system and includes a mounting point for hanging the STS on an inside wall of the apparatus. When the responders determine that stair transport is required, one responder retrieves the stair transport system from the apparatus and carries it upstairs to the location of the incident. Following the standard lift and transport procedures, the patient is wheeled to the top of the stairwell, where the responder behind the lift ensures that the handles face towards them and away from the lift. Then they install the upper handles, one at a time, as described earlier in the stair handle set procedures, making sure that the handles are locked into the operational position. Next, they position the stair tread adapter behind the lift with the silver portions of the support struts facing upward and release the struts by pulling them outward from the storage clips. Then they insert one of the support struts into the corresponding mounting point on the bottom of the lift. You'll hear a click as it locks. Then they pull upward on the strut to ensure it's firmly locked into position. The responder follows the same procedures for installing the second support strut into the mounting point on the other side of the lift and pulls on both struts to ensure they are fully secured to the HFL. Next, the responder behind the lift locates the stair tread fixed pin on the lower right side of the HFL as seen from the back and positions the lower right side of the stair tread adapter over the fixed pin as shown. This secures the right side of the stair tread adapter into position. The responder then locates the spring-loaded left side locking pin and pulls it inward towards the center of the lift, giving it a quarter turn in either direction to lock it open as they position the lower left side of the tread adapter in place and release the locking pin by giving it a quarter turn in either direction. This allows the locking pin to secure the left side of the tread adapter. Finally, the responder pulls on the adapter to ensure it's fully secured. Important note: installation and removal of the stair tread adapter should only be performed when a patient is seated and secured to the lift. Installing or removing the stair tread adapter without a patient on the lift will cause the lift to fall rearward. With the patient properly secured for transport at the top of the stairwell with their arms crossed and feet together, the responder behind the lift tilts the HFL rearward, allowing the responder in front of the lift to attach the lower handles. The responder behind the lift ensures that the angle of the treads conform to the angle of the stairs, allowing the treads to bear the load as the responders work together to safely transport the patient down the stairs. At the bottom of the stairs, the responder in front of the lift removes the two lower handles and, if there are no obstructions, the responder behind the lift can simply transport the patient to an awaiting gurney with the stair tread adapter and upper handles in place. Note: if there is limited space at the bottom of the stairs, it is recommended that the responder behind the lift tilt the unit to the upright position, then detach the stair tread adapter and set it aside. Then detach the upper handles and set them aside before transporting the patient to an awaiting gurney. This allows for maximum maneuverability. By the way, as previously demonstrated in the stair handle set procedures, if you need to transport a patient upstairs or an emergency situation requires transporting a patient over obstacles or through uneven terrain, you can use the stair transport system's upper and lower handles without the stair tread adapter attached.
In emergency services, the safety of our patients and our fellow responders is paramount. IndeeLift HFLs for EMS protects patients and providers by eliminating manual lifting, while providing greater patient comfort and dignity. In this video, you've seen the proper procedures for using these EMS tools. The user's manual that comes with each unit also provides detailed information on each of these procedures. Keep it handy for future reference. IndeeLift for EMS is the safest way to pick up patients for the patient and the providers. I wish you all a long and safe career in EMS, and thank you for watching.